Hey guys, Cole here. Today I'll be a reporter on a broadcast on a syndrome called Klinefelter syndrome. In today's broadcast, we'll be meeting with Dr. Hutchins as he informs us on how Klinefelter syndrome works and tells us some treatments about it. Then we'll be seeing Dr. Harms while he talks about his patient's life when he was diagnosed with Klinefelter syndrome. I hope you enjoy our broadcast and get an understanding about how Klinefelter syndrome functions. Hi, today I'm joined with Dr. Hutchins.
Nice to meet you.
So why do these people have Klinefelter syndrome and how do they get it?
What is happening is they are born with an extra X chromosome, so they are a male with 2 female chromosomes. What this does is it affects how they appear and how their genitalia works, among other things. For starters, they will most likely have a smaller sperm count and will be infertile. They also have enlarged breasts and produce very little testosterone, the male hormone, which, as I said before, will result in little to no sperm count, but they will also have a small penis and testes. These people will also gain increased belly fat, a lower sex drive, lack of energy, little hair on face, armpits, and in the pubic region. They are also higher and will have long legs and a short torso, problems reading, writing, and communicating. It is also possible for these people to have anxiety and depression.
Right, so how rare is this disease and how does it come about?
This is one of the most common chromosomal disorders. It affects 1 out of 500 to 1 out of 1,000 males. It happens by chance. It is not inherited. What happens is if the egg gains 1 too many X chromosomes and turns out to be XXY, he will have this syndrome. It is all random events that occur in the formation of the reproductive cells that decide.
That answers all my questions. Thank you, doctor.
My pleasure. If you have any other questions, feel free to ask me.
Klinefelter syndrome, named after Dr. Harry Klinefelter, who first identified it, is a chromosomal problem where a person with an XY genotype, biologically a male, inherits at least 1 extra X chromosome and sometimes a few extra ones. Having an extra X chromosome makes the testicular cells generate less testosterone, which is a hormone responsible for primary sex characteristics like development of the sex organs as well as secondary sex characteristics like height and body shape. In Klinefelter syndrome, the balance of inhibin, a hormone that inhibits the release of follicle-stimulating hormone, is altered, in that an extra X chromosome interrupts the normal function of the Sertoli and late egg cells. Starting at puberty and continuing throughout life, Sertoli and late egg cells don't produce inhibin and testosterone respectively. This means that levels of luteinizing hormone and follicle-stimulating hormone increase. Less testosterone also suppresses testes maturation and sperm production, as well as development of secondary male characteristic. In fact, each additional X chromosome increases the estrogen to testosterone ratio, making the changes even more striking. Klinefelter syndrome develops when either sperm or egg contains at least 1 extra X chromosome. Symptoms of Klinefelter syndrome are most apparent around the time of puberty because that's when the reduced testosterone levels are most evident. They typically have hypogonadism, or small testicles and a small penis, and are often considered sterile. In other words, unable to have children. Physically, they're typically tall with long legs, a short torso, broad hips, and gynecomastia, or development of breast tissue. They usually have less muscle mass, less facial and body hair, weaker bones, and lower energy levels. There's also an increased risk of diseases that are more common among women, like breast cancer and osteoporosis. Finally, although most boys with Klinefelter syndrome grow up to live as men, some develop atypical gender identities, and some develop female gender identities. Klinefelter syndrome is diagnosed with a karyotype which visualizes each chromosome, including the XY and extra X chromosomes. A karyotype can be done before birth with amniocentesis or at any time after birth with the blood test. Blood tests after puberty can also indicate Klinefelter syndrome because there are lower levels of testosterone and high levels of luteinizing and follicle-stimulating hormones. Treatment is focused on replacing testosterone through hormone therapy, and infertility treatments can make reproduction possible in some cases as well.
Hi, today I'm joined with Dr. Harms to talk about his client, Stephen. So when was Stephen diagnosed and how did it happen?
Well, at first he was going around looking for a diagnosis and never really got one other than to give it time. Then eventually one picked up on an idea of what it could be. He had blood tests sent in and did some other tests on his heart and bones and was eventually diagnosed with Klinefelter syndrome.
How do you think he felt at the time that he was diagnosed?
Well, he told me that he was actually kind of happy. He didn't have to go hopping between doctors asking for a diagnosis anymore.
How much does Stephen understand of Klinefelter syndrome?
Well, I try to keep him informed to the best of my ability. He seems to understand it and comprehend it more as time goes by than all at once.
I think living with Klinefelter syndrome a challenge.
It's super hard to live with. You tend to have a lot of health problems such as weak tooth enamel, aches and pains all over your body, urinary infections, headaches, and an extremely sensitive digestive system.
How does being diagnosed with Klinefelter syndrome change family life?
He said that he had learning problems, relationship problems, and also communication problems, and he was very shy with a low self-esteem. When his testosterone levels dropped, he would get headaches and low muscle tone and would end up being very tired.
Any services or organizations?
No, he wasn't showed any care or support groups originally. He tried to start some and join others, but he didn't get called back.
How do you explain this problem to people that he's met?
He said he often feels left out and his family doesn't really care. He says it depends on the conversation, and sometimes he'll make slight jokes about it.
What advice would you give to someone that's newly diagnosed with Klinefelter syndrome?
Just try to find out as much information as possible and try to get into some other support groups with people with your same condition.
That's all. Thank you.
No problem. Feel free to come back anytime.